My name's Dan Stone. I'm a specialist of urogynecology, also known as female pelvic medicine and reconstructive surgery. So a urogynecologist specializes in the treatment of pelvic floor disorders. So this can include urinary leakage, overactive bladder, and pelvic organ prolapse, which is a protrusion of the pelvic organ, such as the bladder, rectum, vagina, uterus, through the vaginal opening. There's multiple causes of urinary leakage. Some of the most common causes is something called stress urinary incontinence and urge urinary incontinence. So with stress incontinence, it's leakage with coughing, laughing, sneezing, or any other activity that increases the abdominal pressure. So what we do first when we see someone with stress urinary incontinence is do an evaluation to see if there's any other conditions that could be mimicking or exacerbating the symptoms of urinary leakage. And so this will include a full gynecologic exam, testing the urine, and there might be other urinary tests that may be required to make a full diagnosis. So stress incontinence, it's caused by a weakening of the pelvic floor. And there is a sphincter, or a valve, if you will, that holds the urine. And it's meant to hold the urine whenever you cough, laugh, or sneeze, or have increased abdominal pressure. And due to the weakening of the pelvic floor, or damage done due to childbirth, this sphincter can become somewhat dysfunctional, and so that it doesn't hold the urine when we want it to. And so any therapy is going to be focusing on increasing the effectiveness of this sphincter. So the different therapies that are out there are divided into conservative therapies and surgical therapies. The conservative therapies, the main therapy that we discuss, is strengthening the pelvic floor or the sphincter that holds the urine. So there's different ways to strengthen the pelvic floor. The simplest way is to do kegel exercises where you voluntarily flex these muscles in the pelvic floor and strengthen them. And so you usually need to do this several times a day with many repetitions each time you do them, 2-second squeeze, 2-second relaxation. Other ways include electrical stimulation, pelvic floor physical therapy. So other conservative therapy is going to include keeping your bladder empty, avoiding activity that predisposes you to leakage, so avoiding heavy lifting, avoiding the activity that brings it on, keeping an empty bladder or frequently voiding can help, treating constipation can help, and then there's surgical therapy. The gold standard is the mid-urethral sling. And the mid-urethral sling is a surgical procedure where we put a small strip of synthetic material. This material is also called mesh, but a small strip of synthetic material that goes underneath the urethra and supports the urethra so that it stops leakage whenever you cough, laugh, sneeze, exercise. It works very, very well, as a 95% improvement rate. It's considered the gold standard for surgical treatment of stress urinary incontinence. There are also a couple alternatives to mesh mid-urethral slings. The one that I prefer is very similar to a mid-urethral sling, but instead of using mesh, we use your own tissue. Now we have to obtain this tissue from an area of your body, and I obtained this tissue from the fascia overlying the thigh muscles. This is called the fascial lata, and is placed in a very similar way. There are, of course, advantages and disadvantages to this technique, but it works well, and it's a good alternative to mesh mid-urethral slings. There are also office-based procedures, and the main one that we use is something called urethral bulking. And urethral bulking is an office-based procedure. It doesn't require any general anesthesia, and it takes about 20 minutes to perform. It involves injection of the urethra with a bulking agent around the walls of the urethra to narrow its width and help you hold urine. The advantages is that it's quick, office-based, and works very well. The disadvantage is that the effect wears over time. We tend to use this procedure for women who don't desire or can't tolerate the bigger procedure, or for women who are still planning on having more children. In any case, if you or a loved one suffer from urinary leakage with cough, laugh, or sneeze, please don't hesitate to call and set up a consultation with me or one of my partners. At the very least, you can get a diagnosis, get basic information on how to treat this with conservative therapy, or if you desire more surgical therapy or a procedure, we can start that process as well. Our number is 602-788-1521, and our office is conveniently located near the 51 in Glendale Avenue at 1616 East Maryland Avenue, Phoenix, Arizona 85016.